to the guest room and then throw it directly and change with the new gloves. And of course, in between changing, you need to do what?
Wash your hands.
Wash your hands always. Okay? So now is the demonstration. We will show you on how to wear the PPE. For generally, can you raise your hand if you are a nurse in the hospital and in this hotel? Anyone on duty as a nurse?
No.
Okay. Anyhow, it's the same. It's the same process. The only thing, as I said, is they're wearing a different gown. Okay? You will be provided with a regular surgical mask. You don't need an N95 mask because I assume that the guests that we will be receiving are those without any signs and symptoms. Okay? So that is what my understanding. So don't quote me if anything. Okay? That's my understanding. Anyhow, so the first PPE that you need to wear is what? As per the slide here, the gown. Okay? So this is what we call isolation gown. Okay? If I am a housekeeping or I am doing a maintenance inside the room, so I should wear this. The only one required to wear this are those who are entering the patient or the guest room. Remember that. Not everyone is required to wear this. Okay?
How we guarantee that you will not touch the guest because the guest in the room, he might need something or
Yep.
you're going so.
Yep, that's why this is the minimum required PPE for you. This is fine. And I assume that they will give you the asymptomatic guest. Because of course, if symptomatic, they will be in the hospital. It
Yeah.
will be at risk for you then.
For sure, yeah.
Yeah. So always encourage the guests to wear the surgical mask.
Mhm.
That is how we can control. If suppose you enter the guest room, no, you just politely tell them, "Sir, can you please wear your mask?" Make sure that they have a mask available. Yeah.
But for
And-
sure,
and I'm
they're
sure
also
they're-
they will be briefed also for sure, right? The guests will be briefed as well for sure.
Yeah, they will be. They will be briefed for sure. Okay? So make sure that it is covering your body. So what are the principles that we need to remember? The front part of my PPE is the most contaminated. Least contaminated is the back. And when I am to remove this, I should remove it from the back because as I said, this is the least contaminated. And among all the PPE, of course, the most contaminated is my gloves. Yeah. So what's the next? Respirator. Okay. So the colored one should be outside. Okay, what's the next one? Goggles, this is only for the nurse, huh? Housekeeping, it's not required. Okay, because I don't assume that I will have a close contact to the patient or the guest. I'm sorry, I'm used to saying patient. So you are supposed to be provided with the goggles. This is reusable type. In the hospital, we used to wear this one, face shield. Yeah? So just wear it as normal, like that. And then finally, I will be wearing my gloves. Make sure that the gloves, if I am a housekeeping, oh my God.
Made in China.
But
Made in China.
Best is, it should be over your gown. Okay, so at least it can protect your undergarments. Again, if I am wearing a long sleeve, I should remove my coat and I should fold my sleeves. That's the best practice, especially if I'm wearing this gown. Okay? And if I am wearing any jewelry, like the watch or the ring, it is not advisable then. I should remove it. Think of it like you are protecting yourself and your family. Because with the jewelry, I didn't remove it, sorry. With the jewelry, it would compromise you in doing the proper hand hygiene. Same goes with the ring. Okay, you need to remove it. Keep it at your home. Okay? Or if you forget, you just put it in your tissue and keep it in your pocket. Okay? Now, am I clear to enter the guest room? I am. I am the housekeeping or maintenance doing my task inside the guest room. Open the door, step in. If I see the guest not wearing the mask, I'll ask him to wear the mask. I did my task, finished everything. As I said, the most contaminated is the gloves. Now, so there's a technique on how to remove the gloves. Okay, take it from the rim. Okay, and then do inside and out, and then just grab it to, using your other hand. Okay, and then with your uncontaminated hands, you just slide it under the other gloves, inside and out, and then throw. That's what we call like a bag technique. Then throw. After I remove that, there's a hand washing sink or a hand rub I should wear. I should do my hand rub. Okay? Done? Second is I will remove my goggles. This is again for the nurse. Yeah, I just simply need to remove it. Later I can clean it with the alcohol wipes. This is reusable. Okay? Next is I will remove my gown. How do I remove that? By? I don't want to break it then. Because we will still be using this in, we have another venue to visit.
But for you, if you're using this, you can
You
use
can
it.
simply break it.
Yeah.
Yeah? Okay.
So it's only one time.
Yes.
One time, yes.
Yeah. But you can use from one room to another.
You
And
can use,
as long as it's not torn.
yeah, as long as it's
There's
not
no
done.
holes in it.
The only PPE you will change is the gloves. This is what I'm trying to show you now is in case I finish my full task for the whole room, the rooms that I am serving. Okay? Now, as I told you, the back side is the least contaminated, right? So I should take it from the back. See? Inside out. Okay? And then inside and out. And then roll it a little bit. Don't shake it, okay? Don't shake it. Just a little bit roll. And then throw it. Okay? Okay. Now, with the mask, okay, as I said, you should remove it from the back. Yeah? Simple. And then don't touch this part. You know why the articles are saying that if you are wearing a surgical mask, you are much riskier to get the COVID? Because the viruses is being trapped here. And what people usually do, they will put it on their chin.
Yeah.
Yeah, sometimes here, you know, they want to cover their forehead. I don't know why. But usually, it covers like this also. This is not correct.
Yeah.
Please don't do it. Don't be that guy that protects his mouth but not his nose. What is this? Because he's bad breath or what? He doesn't want to smell his breath? No, you shouldn't do that. It should cover the nose and the mouth. And then again, as I told you, the virus is being trapped here. That is why don't touch it. Don't touch the front part. Yeah? And remove it from the thighs and then this pose. Then, what's the last part I need to do?
Wash your hands.
Always wash your hands.
Okay, and what we go, where we can go with it?
That will be identified by your management. But best practice for you probably is to have a separate bin. aside from the bin inside the guest room. I think it's not appropriate if you will throw it inside the guest room. So it's much better if you have a separate bin for this purpose. Yeah? Okay? So hand rub, then I am free to go. Okay? Any question?